The moment when somebody is diagnosed with cancer, it's very important to recognize you are also still in control, not be the same way that it was before, but it's important to recognize all of the things that you still can control, because there's a lot that you can do as a patient to really make sure that you are optimizing or giving yourself the best possible shot. Just how burdensome that is. And patients go through it, kind of, they put their heads down and they just get through it, and then they kind of come through and they realize all that they've accomplished. And I think that paying note to that can be really empowering. One must live well, be present, and live their life as they're going through the therapy, and not just put life on hold and wait to live life until after therapy is complete. There has been a bit of a shift as we've given ourselves the permission to prioritize quality of life. Sometimes patients feel almost like in prioritizing quality over quantity, they might be giving up, or they might be letting their families down because they're not maybe going for the home run. Patients sometimes feel a tremendous amount of stress, anxiety, guilt, burden in making that choice because they feel like they're letting the people around them down, or they feel like they're giving up, when truly that's not giving up. That's in prioritizing one's own quality of life and in prioritizing one's own priorities and the things that are the most important to them. That's taking agency. That's making a decision that is correct for you, and nobody can tell you what's the right choice for you but you. And how's that going to affect me now, and how's that going to affect me in 5 years, and how's that going to affect me in 10 years? And what does life look like if I take those different paths? And that's kind of the essence of survivorship. I never ask a patient to make a decision quickly, especially a new diagnosis of prostate cancer. This is not a burning building that you have to run into. There's data that suggests that one just needs to make a decision in localized disease within about 3 to 4 months. That's time for patients to take advantage of and say, okay, what matters to me? And this is a time to really be honest with oneself about what are your priorities. You kind of have to speak with your physician about what does the acute therapy look like? What are the clear risks of those therapies, and how do they stack up? Well, I think that's a hard part of it. And if patients don't feel like they're getting enough information, then they need to find somewhere where they can get the good information, because these decisions can't be made without being fully informed, or they shouldn't be. You can advocate, you can say, my questions aren't answered yet. I still have questions. I still have things that I need to learn about. You don't want to have surface conversation. Tell me more about urination. Tell me more about sexual function. We can't be embarrassed to talk about these things when we're talking about one's own functions and what that means for the rest of life. I don't think you can expect a patient to ask about all things, because how would somebody who is not trained in this field know to ask about? Now, that's not saying that patients don't, because I have a lot of very well-read patients who come in and they have incredibly insightful questions, and they come in and they're ready to talk about all this. But I have other patients who maybe haven't spent as much time and maybe don't have as high a level of, say, healthcare literacy, or just don't have the language. They don't, or maybe are embarrassed to talk about. Outcome is defined by the patient with the prostate cancer. What is his priority? It's not what my priority is or what some clinical trials priority is. My job is to understand what his priority is, and then to give him all the tools and sort of support sort of the path, guide us on that path, so that we can hopefully maintain and achieve that.